What are your fingernails trying to warn you? The human body has a unique way of signaling health issues, and sometimes these signs appear in places we least expect, like our fingernails. Take a good look at your fingernails. If you're seeing changes in the appearance of your nails, this may be a clue that there are health problems inside your body. A healthy fingernail should have a smooth texture. Its color should be consistent and pinkish, showing a uniform natural shade that matches your skin tone, with a slight pinker bed under the nail indicating good blood flow. The nail itself should be firm and not easily bendable. The cuticles should be intact. A healthy nail has a slight white crescent-shaped area at the base, the lunula, more visible on the thumb. The edges of the nail should be smooth and neatly rounded, and overall it should appear well-moisturized. Here are 7 signs your fingernails are trying to tell you that you may have some internal health problems. 1. Nail ridges. When we observe our nails closely, we might notice various patterns and textures that seem unusual, such as ridges running across them. These ridges can appear as raised lines that run either vertically lengthwise, from the cuticle to the tip of the nail, or horizontally across the nail. Understanding that these ridges can be both normal and indicative of health issues, depending on their appearance and associated factors. Vertical ridges, which are more common, typically run from the base of the nail to the tip. Often, these ridges are a natural part of aging and are not a cause for concern. They occur because, as we age, the nail bed produces nails more slowly, leading to pronounced ridges that were previously less visible. In most cases, vertical ridges are benign and don't signal underlying health problems. However, if these ridges are accompanied by changes in nail color or texture, it might be worth consulting a healthcare professional for a closer look. On the other hand, horizontal ridges, known as Bowes lines, can be more concerning. These ridges are deep lines that run across the nail, and they may indicate that the body has undergone stress or illness. Bowes lines can appear as a result of a temporary interruption in the growth of the nail, caused by severe illness, nutritional deficiencies, or certain medications. These ridges can provide a timeline of health disturbances, as they reflect periods when the body focused its energy on recovery, diverting resources away from less critical functions like nail growth. It's essential to view nail ridges in the context of overall health and other symptoms. For instance, if horizontal ridges are observed alongside symptoms such as fatigue or weight loss, they could be signaling a more systemic issue that requires medical attention. Diseases like diabetes, thyroid disorders, and certain autoimmune diseases can manifest changes in the nails, including ridging. 2. Reddish nails. The habit of nail biting can also lead to a reddish appearance under the fingernails. This is because biting can be harsh enough to cause minor bleeding or tearing, allowing blood to seep into the area beneath the nails, known as the matrix. This scenario is common among habitual nail biters. The good news is, if the biting stops, the reddish coloration typically fades away as the area heals, and the nail cells regenerate normally. Our nails serve as a protective barrier and reflect the health of the underlying structures of our hands and fingers. Therefore, changes in nail color or texture could hint at various health issues. Besides the mechanical damage from nail biting, reddish nails can also be indicative of more systemic conditions. For example, a condition known as splinter hemorrhages, which appears as small, reddish-brown lines under the nails, can be associated with heart valve infections or other heart conditions. In some cases, reddish nails might also signal nutritional deficiencies, such as a lack of iron or vitamin B12, which are essential for healthy nail growth. When we talk about reddish nails, it's essential to tread carefully between what's normal and what might be a sign of something more serious. Not all reddish nails indicate a health problem, and in many cases, this coloration is harmless. However, it's the context and accompanying symptoms that matter. If you notice that your nails are not only reddish, but also accompanied by symptoms like pain, swelling, or tenderness, It's a signal that your body is trying to tell you something important. 3. Nail pitting. Nail pitting is a condition characterized by small, pinpoint depressions on the surface of the nails. It's like looking at a miniature golf ball, where the surface isn't smooth but dotted with tiny indentations. This peculiar nail texture can be more than just a cosmetic concern. It may also serve as a subtle hint from our bodies that something might not be quite right on the inside. Understanding the potential significance of nail pitting requires us to look beneath the surface, both literally and metaphorically, as it can be associated with several health issues. One of the most common conditions linked to nail pitting is psoriasis. Psoriasis is an autoimmune disease that causes skin cells to multiply rapidly, leading to scaly, red patches that can be itchy and painful. However, psoriasis doesn't limit itself to the skin. About half of all individuals with psoriasis will experience changes in their nails, including pitting. The presence of nail pitting in someone with psoriasis can be a sign that their condition is affecting more than just their skin's surface, offering clues to the broader impact of the disease. Beyond psoriasis, nail pitting can also be associated with other autoimmune disorders, such as alopecia areata, an autoimmune condition that causes hair to fall out in small patches. This connection underscores the role of the immune system in affecting various aspects of our health, including the appearance of our nails. Furthermore, nail pitting has been linked to arthritis, specifically psoriatic arthritis, a type of arthritis that affects some people with psoriasis. This condition can lead to joint pain, stiffness, and swelling, with nail changes often serving as an early warning sign. It's important to approach the observation of nail pitting with a sense of caution and curiosity. Not every case of nail pitting signifies a serious health problem. Sometimes, it can result from minor injuries or trauma to the nail. However, if the pitting is extensive, occurs on several nails, or is accompanied by other symptoms such as joint pain, skin changes, or hair loss, it may be wise to consult with a healthcare provider. They can perform a comprehensive evaluation to determine if the nail pitting is part of a larger health issue and recommend appropriate treatment or management strategies. 4. Bluish nails. If you're finding this information helpful, we encourage you to show your support by liking this content, subscribing to our channel. Bluish nails, scientifically known as cyanosis of the nails, can indicate that there's a decrease in oxygen levels in your bloodstream. Oxygen is vital for our body's functioning, and its deficiency can lead to various health issues. The bluish color appears because, when there's not enough oxygen in the blood, it turns a darker color, which can show through the somewhat transparent nail and skin tissue. This symptom can be a sign of several conditions, ranging from more benign issues, like being in a very cold environment, to more serious health concerns, such as respiratory diseases, heart problems, or circulatory issues. For example, conditions like chronic lung diseases, including emphysema and chronic bronchitis, can lead to a decrease in blood oxygen levels, resulting in bluish nails. Similarly, heart conditions that affect blood circulation or the heart's ability to pump blood efficiently can also cause this symptom. It's also worth noting that in some cases, bluish nails can be the result of localized problems, such as a vascular blockage in the fingers, rather than systemic health issues. Given the range of potential underlying causes, it's essential not to jump to conclusions based solely on the appearance of bluish nails. Instead, consider whether there are other symptoms present, such as difficulty breathing, chest pain, or a general sense of fatigue and weakness. 5. Brittle nails. Cracked or brittle nails can often catch our attention and prompt concerns about our health. These conditions are not just cosmetic issues, but can sometimes indicate underlying health problems. Cracked nails, which may split or fissure on the tips, and brittle nails, which tend to break or chip easily, can be the result of various factors, including environmental exposure or certain health conditions. Brittle nails, medically referred to as onychorexis, can be a sign of aging or a consequence of prolonged exposure to water, harsh chemicals, or environmental conditions that dry out the nails. However, when brittle nails are persistent and not clearly linked to external factors, they may hint at nutritional deficiencies or health issues. For instance, a lack of vitamins and minerals, such as biotin, vitamin E, iron, and zinc, can contribute to weakened nail structure, leading to brittleness. This condition can also be indicative of hypothyroidism, a disorder where the thyroid gland doesn't produce enough hormones, affecting the body's metabolic rate and leading to symptoms including brittle nails. Cracked nails, particularly when accompanied by other symptoms, can point to fungal nail infections or psoriasis. Fungal infections can cause the nails to become thick, discolored, and more susceptible to cracking. Psoriasis, a chronic skin condition that can affect the nails, leads to pitting, abnormal growth, and cracking. In some cases, cracked or splitting nails may also be associated with a condition called lichen planus, an inflammatory condition that affects the skin, hair, nails, and mucous membranes, leading to various symptoms including nail abnormalities. It's a reminder that our nails are not just aesthetic features, but are closely linked to our overall health. They can serve as a visible sign of the body's internal balance or indicate that something may be amiss. 6. White spots. White spots on nails, often noticed as small, painless dots or patches, are a common phenomenon that many people experience at some point in their lives. Known medically as leukonychia, these spots are usually not a cause for alarm and often result from minor traumas to the nails, such as bumping your nail against a hard surface. The spots are typically the result of an injury to the nail matrix, the part of the nail bed that is responsible for nail growth. As the nail grows, these spots usually move upwards and eventually disappear at the tip of the nail. However, it's important to view white spots with a balanced perspective, especially if they persist or are accompanied by other changes in the nails or overall health. In some cases, nutritional deficiencies are an underlying cause of persistent white spots. For example, a deficiency in zinc, calcium, or certain vitamins could potentially manifest as changes in nail appearance, including the development of white spots. Another potential cause is a fungal infection, which can affect one or more nails, leading to discoloration, thickening, and sometimes white spots. This condition requires medical treatment to fully resolve. Rarely, white spots on the nails can be indicative of more serious systemic health problems. Conditions such as chronic kidney disease, certain liver diseases, or even poisoning from heavy metals like arsenic can cause changes in nail coloration, including the appearance of white spots or bands across the nails. These more severe causes are typically accompanied by other symptoms, underscoring the importance of a comprehensive health evaluation if there are additional signs of illness. 7. Yellow nails. While yellow nails might simply result from external factors like the use of nail polish or exposure to certain chemicals, they can also signal underlying health issues that shouldn't be ignored. One of the most common reasons behind yellow nails is a fungal infection. This type of infection can cause the nails to become thicker, brittle, and change color to a yellowish hue. Fungal infections in nails can lead to discomfort and sometimes pain, indicating the body's battle against the infection. These infections often require medical treatment to fully resolve. Apart from fungal infections, yellow nails can also be associated with more systemic health issues. For example, chronic respiratory conditions, such as bronchitis or sinusitis, have been linked to the yellow nail syndrome. This rare condition not only affects nail color, but can also lead to nail growth slowing down and even detaching from the nail bed in severe cases. Additionally, yellow nails may hint at thyroid diseases, diabetes, or psoriasis, conditions that impact various bodily functions, including nail health. Another critical association of yellow nails is with lymphedema, a condition characterized by swelling due to lymph fluid retention, often in the arms and legs. Yellow nail syndrome can be a sign of this underlying issue, indicating a need for a thorough medical evaluation. In some instances, yellow nails may also reflect liver problems, such as hepatitis, where other symptoms might include jaundice, yellowing of the skin and eyes, adding to the concern that warrants medical attention. Observing yellow nails on your fingers or toes provides an opportunity to review your overall health and consider whether other symptoms might be occurring. While external factors and minor infections can sometimes explain the yellowing of nails, persistent or unexplained changes in nail color should prompt a consultation with a healthcare provider. A professional can assess the nail's condition, consider your medical history, and, if necessary, conduct tests to identify any underlying health issues. It's crucial to remember that while these nail conditions can be indicators of health issues, they are not conclusive evidence of a specific disease. Many factors, including genetics, environmental exposures, and personal care practices, can influence the appearance of your nails. If you observe persistent changes in your nails, it's advisable to consult a healthcare professional. They can conduct a thorough examination and, if necessary, perform tests to determine if there's an underlying health issue that needs attention. Taking note of changes in your nails is a proactive way to monitor your health, but it should be complemented by regular medical checkups and a healthy lifestyle. Thank you for watching Fingernails Warning You: 7 Signs You Have Health Problems on Healthy Vibrance. Don't forget to like, subscribe, and turn on notifications for more health-related content. See you in the next video.